Hello.
Hi.
Hi, my name is Jocelyn. I'll be the one assessing you today.
Alright.
Okay. What brings you here?
My annual physical.
Okay. So I'll start by gathering your health history and then I'll do your physical exam.
Okay.
Okay. So this is the blank form that I'm using for the questions. Okay. So how would you describe your general state of health?
I would say pretty good.
Okay. And any medical problems or illnesses?
I was diagnosed with anxiety and depression like fall of 2015.
Okay, very good. Any surgeries?
I had my wisdom teeth taken out in 2010 and then my appendix removed December 2017.
Okay. Any hospitalizations?
I was in the hospital October of 2017 for a peritoneal abscess.
Okay. Any trauma or injuries?
I broke a couple fingers as a kid, like in 6th grade and 8th grade.
Okay. Have you received all your childhood vaccinations?
Yes.
Okay. And have you received the flu shot?
Yeah, that was October of 2018.
Good. And have you ever got tested for TB?
Yes, the last time was 2018.
Okay. And when was your last tetanus shot?
2017.
And for medications, do you have any prescriptions?
Yeah, just the NuvaRing.
Okay. Do you take any over-the-counter medications?
I'll take Excedrin every once in a while for a headache, like 1 or 2 pills, and then once a day, women's multivitamin, and I would say Motrin as needed for menstrual cramps, like 1 to 2 pills.
Okay, very good. Do you have any allergies?
Just seasonal.
Okay, and what's the seasonal allergy that you have?
To like grass and ragweed.
Okay. And what is your reaction to those allergies?
Like a runny nose, watery eyes, cough.
Okay. And any allergies to contact?
No.
Food or insect?
No.
Latex?
Nope.
Any drug allergies?
No.
Okay, good. And for your health maintenance, when was your last physical?
A year ago, 2018.
And when was your last pap smear?
2017.
And last dental exam?
4 months ago.
Okay. And for your family medical history, I want you to try to go back 3 generations, okay? And if there's any significant cardiovascular, pulmonary, gastrointestinal, renal, endocrine, musculoskeletal, neuro, hematologic, or psychiatric diseases or disorders, okay?
So my biological dad has Crohn's disease. My mom has had basal cell carcinoma twice, 2010 and 2015.
Mm-hmm.
My paternal grandmother died in 2017 of breast cancer. My paternal grandfather died in 2000 and we're not sure of the cause. Maternal great-grandmother died in 1985 of cervical cancer. My maternal grandmother is still alive, but she does have some AFib and hypertension.
Mm-hmm.
Maternal grandfather is still alive, just has some hypertension. And my great-grandfather on my mom's side, so maternal,
Mm-hmm.
died in 2011 of heart failure.
Okay. So I'm going to be evaluating your psychosocial. What is your highest level of education?
BSN,
Okay, when did you graduate?
2016.
Okay. And where do you work?
I work as a nurse at the Cleveland Clinic in the PACU.
Okay. And how long have you been working there?
Like 2.5 years.
Good. And how would you describe your family relationships?
I feel like it's very good. We all support each other.
Good. And what would you describe your marital status?
I'm married.
Okay. And how long have you been married?
5 months.
Okay. What do you do for fun or your leisure activities?
I like to work out, play volleyball, and cook.
Okay. And any stress factors?
My job's pretty stressful.
Okay. And any support systems?
Yeah, my friends and family, for sure.
Okay, good. Any religious beliefs?
Yeah, Christian.
Okay, good. And do you smoke?
No.
Do you drink alcohol?
Yeah, just socially.
Okay, and how many drinks per week?
About 6.
Okay. Any recreational drugs?
No.
Any environmental risk or any exposures?
Probably just being in the hospital at work exposes me to some stuff.
Okay. How would you describe your diet?
I'd say well balanced.
And do you exercise?
I do.
How often?
Like 1 to 2 times a week.
Okay, and what's the exercise?
I work out at Orange Theory. It's like HIIT training.
Okay. And any recent travel out the country?
Yeah, I went to the Dominican Republic September 2018 for just about a week.
Okay. What is your sexual history?
Just one partner.
Okay. And any domestic violence or safety issues?
No.
Okay. So any like recent weight change, feeling really tired more than usual, sleep disturbance, fever, chills?
So none of that except maybe like a slow weight gain over the past year.
Okay. For your skin or hair and nails, any lesions, itchiness, changes in skin, changes in moles?
No.
Any rashes, abnormal hair growth?
No.
Okay. For your head, any recent head injury or history of head injury,
No.
loss of consciousness?
No.
Dizziness?
No.
Headaches?
Occasionally.
Headaches?
Yeah, usually like in the front of my head.
Okay. And how long does the headache last?
I would say within 24 hours it's gone. I take an Excedrin and it works.
Okay, very good. Eyes, any like changes in vision, double vision?
No.
Do you wear glasses or contacts?
I wear contacts during the day and glasses at night.
Okay. When was your last eye exam?
May 2018.
Okay. And for your ears, have you had any like earaches, tinnitus, dizziness, discharge?
No.
Okay. Or hearing loss?
No.
For your nose, have you had any nosebleeds, congestions,
No.
allergies?
Just the seasonal.
Okay.
Yeah.
For your mouth and throat, have you had any sore throat, hoarseness?
No.
Bleeding from your gums?
No.
Okay. Any pain with swallowing?
No.
Okay. And when was your last dental exam?
October 2018.
Okay, good. Any for your neck, any swollen glands or neck pain?
Nope.
Pain with movement, lumps? Okay.
Mm-mm.
For your breast, any lumps, pain, or discharge?
No.
Do you know how to perform your self-breath exam?
Yes.
And how often do you do that?
Monthly.
Okay, good. And for your pulmonary, do you have any coughing up anything, any blood
No.
when you cough? Any pain with breathing?
No.
Okay. Any difficulty breathing?
No.
Okay. For your cardiovascular, any chest pain, shortness of breath?
Nope.
Okay. Palpitations, murmur?
No.
Okay. Any trouble lying flat?
Nope.
Or dizziness? Have you had a EKG at all?
No.
Okay. What is your exercise tolerance?
I would say it's average. I can run like a mile at a time.
Okay, good. And for your gastrointestinal, any trouble swallowing, nausea, vomiting?
No.
Any of that? Any ulcers or abdominal pain?
Mm-mm.
Okay. Changes in your stool or blood in the stool?
No.
Okay. Any for genitourinary? Any frequency with urination or painful urination?
No.
Any more urinating more frequently at night?
No.
Incontinence or renal stones?
No.
Okay. Or changes in the urine, blood
No.
in the urine?
No.
Okay. For your reproductive system, when was your last pelvic exam?
I would say that was like April 2018.
Good. And when was your last pap smear?
2017.
Any menstrual problems?
I mean, when I was a kid, I was diagnosed with dysmenorrhea, like 2015. Or, no, it was when I was 15 years old. That's more accurate.
Okay. Okay, and do you take anything for that?
Right now, I just stayed on contraceptives my whole time since I was 15, so now just a NuvaRing.
Okay. Any vaginal discharge?
No.
In any other contraception?
No.
Use? Okay. And history of pregnancies?
No.
And sexual partners?
Just one.
And history of STDs?
No.
Any? Okay. Any seizures, numbness, tingling,
No.
weakness, for your musculoskeletal, any joint pain, stiffness?
No.
Any neck or back pain?
Nope.
Okay. Any anemia, easy bruising?
No.
Or blood transfusions?
Nope.
Or reactions?
Mm-mm.
Endocrine, do you have any excessive thirst or urination?
No.
Do you have any like heat or cold intolerance?
No.
Extreme weight gain or weight loss?
No.
Okay. Changes in like your hair or nails?
No.
Okay. So, psychiatric. Have you received treatment for any psychiatric disorders?
So I've never been hospitalized, but I've been on and off some medications. Like when I was first diagnosed in fall of 2015, I was on Wellbutrin and Lexapro,
Mm-hmm.
and I was on that for about a year, and then went off, and then went on some Lexapro in like 2018,
Mm-hmm.
or Zoloft, sorry, Zoloft in 2018, and then I'm no longer on any medications for psych stuff.
Okay. Is there a reason you stopped taking the Zoloft?
Yeah, I didn't like the side effects.
Okay. What were the side effects?
Like weight gain and night sweats.
Okay. And since you're currently on medication, do you have any plan to help with these illnesses?
So, I feel like if my symptoms become unmanageable, I'll see my psychiatrist. But for now, I'm just staying busy and staying active and staying involved with my friends and family.
Okay. Very good. Any mood swings, hallucinations, or delusions?
No.
Any suicidal thoughts?
No.
And any sleep disturbance? Or how's your sleep?
It's good most of the time, but I notice when I'm more depressed, I sleep more.
Okay. Okay, very good. All right, now I'll start with, I'll begin your head to toe assessment.
Okay.
Let me just clean my hands here. Okay, so I'm just like looking at your skin here. Looks very even. And you could remove your sweater. Okay. Color is nice and even. I'll just be feeling, okay?
Okay.
The temperature, nice and warm bilaterally. No lesions noted. I'll be testing your skin recoil is brisk. I'll be looking at your hair here. So hair looks good, even distribution, dark brown, wavy in texture. No lesions in the scalp here. Any tenderness on your head here?
No.
Okay. And now I'll be just looking at your face here too. I want you to tell me. I'm gonna fill with this, and you tell me if you feel it, okay?
Okay.
So testing on your forehead.
Yep.
And
yep.
Here on your cheek.
Yes.
Okay.
Yes.
So she feels when I touch her there. So that's testing cranial nerve 5. And then now I'm gonna be looking at touching your eyes. So now I'm gonna have you look at the chart behind me. So you tell me the smallest line you can read, cover one eye.
Okay.
Yeah, your right eye's fine.
So LDCZOTE.
Very good. And then cover your opposite eye and read the same line backwards.
ETOZCDL.
Very good. And now I'm gonna be testing your pupils here. So I'm gonna have you focus over my shoulder on the wall and then focus on my pen light. Very good. So as she her eyes focus on something closer to her, her eyes constrict for accommodation. And then just trying to lighten your eyes, okay? Okay, so as I shine the light in the tested eye, her pupils constrict. That's testing cranial nerve 2. And then I'm going to ask you to, with your eyes only, to follow my pen light, okay? Okay, very good. So that's testing cranial nerve 3, 4, and 6. And her pupils are round, are equal, round and reactive to light and accommodation. Okay. And I'm just going to be looking at the outside of your eye structure. So just look down, just looking at your eyelids. No redness there, no swelling. And then if you have you look up towards the ceiling and pull it down. Conjunctiva is clear, no exudates. And then look forward. Black rolling ducts are clear, lightish pink. And then her sclera is nice white and clear. And her cornea is nice and clear too, and pink. And then now I'm going to be looking inside your eyes, okay?
Mm-hmm.
Okay, you just look straight ahead. Okay, look in the other eye. Okay, good. So I see her retina has a red reflex. Pupil has a red reflex, I'm sorry. No black densities. And then her cornea has is yellow to reddish, and no black densities. And eyes, ears. So I'm just assessing your ears now. So ears look uniform to the color of her face. It's ears. I'm just going to be palpating here. No, and you tell me if you feel any tenderness.
No.
Okay. And I'm pressing by her mastoid behind her ear. Any tenderness there?
No.
Okay. So, any tenderness here?
Nope.
Okay. Any tenderness by here, behind your ear?
No.
Okay, so no discharge, no lesions or tenderness noted. And look inside your ear, okay?
Mm-hmm.
Okay, so tympanic membrane appears to be pearly gray there. And same in the the right ear. And the internal canal appears clear. No lesions. Now I'm going to be looking at your ears again. Sorry. I'm going to test cranial nerve 8. So I'm going to ask you to take your finger and wiggle it in your left ear, and I'm going to say a sentence, and then I want you to repeat it back to me, okay? So go ahead and wiggle in your ear. The dog jumped over the fence.
The dog jumped over the fence.
Very good. And do the same other ear. The cat ran under the bush.
The cat ran under the bush.
Very good. So, and then I'm going to use a tuning fork, and I'm going to strike it and put it in the base of your skull, and you tell me if you hear it more in your left ear, your right ear, or equally in both. Okay? Ready?
Equally in both.
Very good. Okay, now I'm going to strike it and put it behind your ear, and you tell me when the ringing stops, and then I'll put it a couple centimeters away from your ear, and you tell me when the ringing stops, okay?
Okay. Alright, it stopped. It stopped.
Okay. Do the same on the other side.
It stopped. It stopped.
Okay, so normal air conduction is twice as long as bone conduction. Okay. Now I'm just going to ask you to raise your eyebrows. Okay, close your eyes shut, and then smile. You can open your eyes and frown. Puff out your cheeks. That's assessing cranial nerves 7. Okay, now I'm gonna assess your cranial nerve 1. Okay. So I'm gonna have you smell this with your eyes closed, and you tell me what it smells like. Okay.
Okay. Oh, peachy.
Okay, good. She got it right. It's peach. Oh, I'm gonna be looking at your nose, okay? So, the skin color matches the skin color of her face. No nasal flaring noted. And her septum is midline. And then I'll be palpating too. Any soreness there?
Nope.
Okay. And then I'm gonna look inside your nose, okay?
Okay.
So you could just kind of tilt your head up. Good. So, inside our internal ear, our nose is pink and glistening, and no turbinates. So now I'm going to be looking at your mouth. Oh, and I had to assess your sinuses, so let me not forget that. Assessing your frontal sinus. You tell me if you feel any pain, okay?
No pain.
Any pain there? Any pain here?
No.
In your maxillary? No pain in the frontal or maxillary or swelling noted. It's sinuses. And now I'm assessing your mouth here. Your lips appear pink. No lesions noted. Okay. And I'm going to be putting on my gloves here and look inside your mouth, okay?
Okay.
Okay, before I do that, let me just take these off. I want to assess your, for TMJ. So I'm gonna have you open up your mouth, okay, and I'll put my hands here, and then close your mouth, clench. Okay, good. So I didn't feel any clicking or popping, so no TMJ or any. But did you feel any soreness when you did that? Okay. And I'm just going to be looking at your teeth, so just say cheeks. Okay, good. So her teeth interdigitate upper and lower, and her gums appear to be nice pink color. And then can you open up your mouth, just looking inside? Oral pharynx appears nice and pink. I'm going to be testing your strength of your tongue, okay? So I'm going to, you push your tongue against my finger, okay? So good and good. So that's assessing cranial nerve 12. And I'm going to have you open up your mouth, okay? And say, Okay, so elevation of uvula is expected. And that's testing cranial nerve 9 and 10. Okay, so now I'm going to be assessing your neck here. Okay, so I'm going to assess her lymph nodes. Okay, so back of the skull, occipital, preauricular, above the ear, behind the ear, preauricular, tonsillar, base angle of the mandible, submandibular, here submental, superficial cervical, deep cervical, along here, posterior cervical. So I didn't feel any lymph nodes were palpable, so that's a normal finding. And then her trachea is nice and midline. So now I'm going to be palpating your carotids here. Okay. Carotids are palpable, and I'll be listening with the bell. Okay, no buries were noted. Okay, and now I'm going to assess cranial nerve 11. So I'm going to have you shrug your shoulders against my resistance. Okay, very good. And I'll be assessing your neck. So if you could turn your head to the right. Okay, good. So assessing for JVD and to the left. So no JVD. And now I'm going to be assessing your lungs. Range of motion with your when you're sitting. Sorry. So can you turn your spine? Yep, side to side. Very good. And now I'm gonna assess your thyroid. Not your lungs yet. Okay. So your thyroid. I'm just looking and I don't see. It's not protruding or anything. And do you have your water?
Yes.
Okay. So I'm gonna instruct you to take a sip and put your head back, then swallow. Okay, very good. So as she swallows, the thyroid elevates. Okay, and now I'm gonna be feeling you for your thyroid. Okay, so first I'm gonna feel on either side. So it's pliable, non-tender, nice and soft. Any tenderness?
Nope.
Okay. So now I'm gonna have you take a sip and swallow. Okay. Okay. And it moves with drinking as well. And I said no JVD already. So good there. And now I'm gonna be assessing your chest. So looking at her chest, as she breathes, her chest expands symmetrically. I don't see any use of accessory muscles with respirations. Her chest rises and falls symmetrically with respirations. And when I put my fingers at the 10th rib, and take a deep breath, and go. Okay, so my fingers diverge equally with respirations. And I'm just gonna be palpating, okay? You tell me if you feel any tenderness.
No. No.
Okay, and look the same. Can you turn towards the wall there? Okay, so I'm going to be palpating back here.
No tenderness.
Okay, good. Sorry, my hands are cold. And then her AP ratio is 1 to 2. And you could come face me again. And now I'm going to percuss. Okay, can I do your back? Mm-hmm. And can you fold your arms over?
Like this?
No, fold your arms close.
Oh.
Yeah, and do your back. Okay, very good. And now I'm gonna listen. Before I do that, I want to check for tactile fremitus. So I'm going to say 99, or you're going to say 99 while I fill, okay?
Okay. 99, 99, 99, 99.
Good. And then your back.
99, 99, 99, 99.
Good. So tactile or fremitus was symmetrical. And now I'm going to listen. Deep breath. Okay, now listen to your back. Deep breath. Okay, very good. And then you can stay on this side, just how you are. And I'm going to have you raise your right arm up, and I'm going to palpate or percuss here. And listen. Good. And same thing on the other side. Okay, very good. I'm going to listen. You stay just like that. Okay, very good. So when I percussed in all her long fields, I heard resonance and dullness over organs. Okay. And now I'm going to assess the heart. So we did the JVD. We checked for JVD. And I'm just looking at her chest in general. And I'm just gonna start by, I'm gonna have you sit over here, I think. Sit over here. Over there. I need this in. Oh, no, need the roller. Okay, so while you're sitting there, I'm just gonna listen. Well, first I'm gonna palpate, okay? Tell me if you feel any tenderness.
No.
Okay. So I'm going to listen with the diaphragm first. So the aortic, pulmonic, tricuspid, and mitral. And same thing with the bell. So I heard all her heart sounds normal, S1, S2 normal, no murmurs or extra heart sounds. And I have you just lay straight down. So aortic, pulmonic, tricuspid, and mitral. Aortic, pulmonic, tricuspid, mitral. And then if you could lay on your left side. Perfect. Aortic, pulmonic, tricuspid, mitral. And same thing with the bell. Aortic, pulmonic, tricuspid, mitral. As I feel, I don't feel any thrills or heaves. I see her I can feel her apical pulse at the 5th intercostal midclavicular line, left. And that's it. I don't see any abnormal pulsations. So now you can lay back on your back. I'm just going to be looking at your abdomen. So I don't see any cyanosis or jaundice, no abdominal distension. So I'm going to have you turn to your right there, looking at your flanks here and the other side. Okay, good. And you can lay back on your back. And femoral artery, everything looks good. I don't see any hematomas or abnormal distensions. And now I'm just going to be, now I'm going to listen to your abdomen. Okay, so I can hear sound. I auscultate all the sounds in all 4 quadrants. And I'm just going to be palpating, okay? You tell me if you feel any soreness, okay?
Nope.
No, okay. And I'm going to percuss. Okay, so I heard some tympany over the intestines, dullness still in the organs. So now I'm going to auscultate the abdominal aorta. Renal arteries, iliac arteries, liver, and spleen. So now I'm going to check for the liver span, or measure your liver span. Okay. So I start at the bottom. Mark. When I hear tympany to dullness, that shows me the lower border. That's what I marked on the right side. And then work from resonance to dullness. So right there. And that tells me the upper border of the liver. And I'm going to measure. So that was 7 centimeters. Normal is 6 to 12, so she has a normal liver. Okay. So now I'm gonna palpate for your liver. So just take a deep breath. Okay. But don't feel the liver. Okay. Breathe normal, and then I'm gonna have you take a deep breath and feel for your spleen. Okay. Wasn't able to feel either, so that's normal finding. And then I'm gonna palpate the abdominal aorta if I feel any pulsations, which I don't. And I'll palpate the femoral arteries here. So both femoral arteries are present and equally in both. Now I have you sit on the edge of the bed here. I'm just going to look at your hands here and your nails. Okay. So nice and even are her nails and nail beds. Just, and then her. I'm gonna measure the angle. So the angle, base of her angle, nail base angle, appears to be 160. So that's normal, no clubbing. And her recoil, her cap recoil is less than 3 seconds. Okay, so now I'm going to looking at your palms. So it has pinkish, lighter pink undertone. And then I'm going to check your arms, the range of motion in your arms. So if you could flex and then extend, and then can you rotate in circles? Mm-hmm. Okay, so full range of motion in your arms. And I'm going to inspect, so like no, the skin color of her arms matches the skin color of the rest of her body in both arms. Any tenderness when I touch here?
No.
Okay, so no soreness, no tenderness, no abnormal masses, or no masses. So now I'm going to feel your pulses. So feel your radial, ulnar, brachial. So equally in both, bilaterally. And can I check the range of motion in your hands? So if you could make a fist and open. Okay, so full range of motion in your hands and fingers there. And I already checked the range of motion in your hand. So now I'm going to look at your legs. So color tends to match the rest of her skin. Any soreness there?
No.
When I'm pressing? Okay, so no soreness, no skin lesions, or abnormal skin colors. And then I'm going to be feeling your, or tenderness. So now I'm going to be touching your strength. Can you push against me or push back against you? Okay, good. And I'm feeling your pulses. So dorsalis pedis, posterior tibial, and popliteal. So +2 equally or bilaterally. And then we're assessing your range of motion in your toes. So if you could, wiggle your toes and then forward, flex your feet, point your toes towards your head, and then flex them out, point them out. Very good. So she has full range of motion. And can you do some kicks? Kick my hand and kick me with that foot. Good. So full range of motion in toes, ankles, feet, and knees. And now I'm going to inspect your spine. So I have you stand up. So looking at her spine here. So she has the normal curves of a spine, and with her neck. And then I'm going to have you forward flex. Okay, and then extend back like you're stretching back. Good, very good. And then I'm going to have you turn side to side, your flanks, both flanks, laterally. Okay, very good. And everything looks, any soreness here?
No.
Okay, good. And now I'm going to have you have a seat again. And then I'm going to so now I'm going to check your resistance against mine. So push your hands against mine. Okay, and then squeeze my fingers. Good. And can you push up and push down? Very good. So equal resistance. And same thing with your toes. Push your toes up, toes down. And again, against me. I'm sorry, I'm cold. And okay. Against you. Okay, so she has, I would say 5 out of 5 strength. in all extremities. Then I'm going to assess if you can feel this vibration. So I'm going to have you close your eyes and you tell me where you feel the vibration, okay?
My right knee.
Good. And keep your eyes closed.
My left ankle.
Good. And then I'm going to test your sensation with light and dull touch, okay? So have your eyes closed and you tell me where do you feel me touching you, okay?
The top of my right foot. Inside of my left calf. Inside of my right calf. Outside of my left ankle.
Very good. And then I'll be testing, I'll have you with your finger, can you touch your nose with your right finger and with your left finger? And then can you take your left heel and touch your right and opposite shin? Okay, good. And then I'm going to have you with your hands, can you pat your knees with your palms, and then the back of your hand, same thing. Very good. So able to do those rapid movements. And then I'm going to have you walk with your in a straight line with your opposite foot touching your toes in a straight line. Toes to heel. Okay, very good. Okay, have a seat again. Okay, so now I'll be doing some reflexes, okay? So some deep tendon reflexes. So I'm going to test your brachial. So, okay, and I'll do brachial here too. So as I test her brachial, she has flexion, and biceps, and I'm going to test her triceps for a reflex. Okay, so as I hit the triceps, we have extension of the elbow, and then I'm going to do brachioradialis. So as I test that reflex, we have pronation and flexion of the elbow. And I'll do your knees. So tap your knees here. So as I do the reflex of the knees, we have extension of the legs. And then I'm going to do your Achilles. So as I tap that tendon, we have extension of the leg, or pronation, flexion of the foot, plantar flexion. So now I'm going to do a test for the microfilament. So for pain, so I'm going to have you kind of put your legs, like just extend your legs and close your eyes, good. And then you tell me yes when you feel me touching.
Yes. Yes. Yes.
Good. And now can I test the other foot?
Yes. Yes. Yes.
Okay, good. So intact. And now I'm going to have you do the Ronberg test. So I'm going to have you stand up and have your feet touch your feet close together and close your eyes. So we have some natural swaying. So good, you can open and see. And that's really good. So that's normal, normal swaying of the body. And now I'm going to have you walk across here on your tippy toes. Okay, good. And then you can walk normal. Okay, then walk on your heels. Okay, very good. So she's able to perform that test with even stride. And that's it.